this is absolutely incredible. A lot of people to thank for what they did. I would just like to single out a few people. Bobby Stanford and your group, thank you for the work that you all did in making this possible. It's just incredible. Lisa and Sherry and Jada, thank you all for what you did in terms of getting this ready, staffing and equipment. A lot of work that went on there. And Rosemary, I don't know if Rosemary's up here, but and her team for getting the place ready to open this week. And to our physician leadership, thank you all for what you've done in terms of preparing us for the care that we're going to be given. This floor is going to take care of both medical and surgical patients. It will accommodate about 34 patients in here, and really it leads the way as we continue to grow as a hospital system or a healthcare system. I'd like to introduce Dr. Mike Chang, our Chief Medical Officer, to make a few remarks.
Good morning. My name is Michael Chang, and I have the honor of serving as the Chief Medical Officer here. Just to add on to a little bit to what Dr. Whaley said, you know, we are a trauma center. We are a highest level stroke center. We are a burn center as well. And we just recently opened the Fannie Meisler Trauma Center, our new emergency medicine facility. We can't realize our potential in any of those areas without the capacity within the hospital to back it up. And that's why this floor is so important, because this floor will give us the opportunity to minimize our diversion times in a way that will allow us to be able to care for all those critically injured and ill patients that we take care of here as the only academic health system in this region. Again, this is an integral part of it, and we're moving through in stages, but this is so important to what our mission is as a hospital and as a healthcare system. So just want to put in a little bit of clinical context for you, and with that I'll turn it over now to Jada Gardner, who's going to be running the show up here.
Thank you, Dr. Chang. Good morning. My name is Jada Gardner. I am serving as the nurse manager of the 11th floor. It is truly a pleasure to be here today and finally be able to cut the ribbon on this beautiful, beautiful floor. Being asked to return to University Hospital to develop the nursing team was a challenge that I was ready to accept. We have been fortunate enough to recruit people who are passionate for delivering care to patients of this community. And I must say that these are truly a special group of nurses as they have filled in the gap to help staff the Civic Center. They've provided the COVID monoclonal antibody infusions here at University Hospital as well as at the Civic Center. And now they are here to transition and care for patients that we admit here on the 11th floor. So I just want to say a special thank you to those group of nurses and patient care assistants and ward clerks who have so fluidly adapted as we have met the need throughout this time. And lastly, Dr. Chang is right as he talked about this being not being the most ideal time to fill a new unit as we look for staff and meet the challenges of the national staffing shortage. But we've done it. And here at USA Health, we're doing a special thing, more specifically at University Hospital, and I'm glad to be a part of that. So we can't wait for what's here to come, and we'll continue to help people lead longer, better lives.
Thank you, Jada. That concludes the formal part, other than let's cut the ribbon.